At 6 in our health alert, the benefits of bloodless surgery. That's when doctors perform major surgery using the patient's own blood and no blood transfusions. Mildred Summers had that for her recent heart and valve surgery. Dr. Michael Morant says that they've been doing bloodless surgery at the Toledo Hospital for 9 years, and there are many benefits for the patients. He says it promotes faster healing, helps reduce complications from surgery, and helps reduce the risk of blood-borne diseases.
Also, whenever blood is transfused to a patient, it affects their immune system, routinely in a negative way. Specifically, we learned this in the early years of transplantation.
Dr. Morant says that they actually have medications to build up your own blood supply so your levels are adequate for surgery.
A growing number of people are seeking alternatives to blood transfusion when they require surgery or other medical care, either because of religious reasons, medical concerns, or personal choice. Blood conservation is a new alternative that doctors right here are now offering their patients.
There's really been a strong push in the last year or a couple of years to emphasize decreasing the amount of blood products.
At Memorial Hermann Southwest Heart and Vascular Institute, Dr. Richard Alexander and medical staff there are using an innovative technique known as blood conservation to eliminate the need for donated blood.
The techniques that we have employed here at the Heart and Vascular Institute have allowed us to basically reuse all of the patient's blood so that the patient is never exposed to any blood products that are not their own.
The patient's blood never truly leaves them because their blood is transferred to a heart and lung machine. Surgeons also use a cell saver suction device to retrieve blood lost during surgery. All of it is taken in by the machines, washed and processed before it is returned back to the patient. This is especially important for certain religious groups.
We are able to take care of those patients and patients like them with those types of beliefs by being able to keep their blood in continuity with them.
For patients like Judy Malley, it also means better chance of survival and recovery since her body will not likely reject her own blood. Now, since blood conservation began at Memorial Hermann Southwest Heart and Vascular Institute, more than 1,000 units of red blood cells have been saved.
Bloodless surgery used to mostly be requested by Jehovah's Witnesses. Now more than 25% of patients asking for no donor blood do so for non-religious reasons. Studies show transfusions lead to more infections and complications.
We are probably using blood transfusions too commonly and too regularly and using it for patients who don't need it.
Other ways to avoid transfusions? During the surgery, this cell salvage machine collects blood, spins it, washes it, filters it, and returns the patient's own red blood cells.
It prevents many blood transfusions and having the patient have to receive banked blood.
New blood testing techniques only need a drop rather than a whole tube of the patient's blood. All of these techniques mean safer surgery.
The majority of time, especially in younger patients, we are able to do kidney transplants without the use of any banked blood.
Transplant surgeon Dr. David Leeser and colleagues performed a minimally invasive kidney transplant, which required just a couple of incisions for Angie and a single incision for Osvaldo.
Angie's brother had the kidney removed through an incision about 3 inches long, right around the belly button.
The operations went flawlessly, and just 2.5 weeks later, the siblings are well on the road to recovery.
Today, bloodless surgery is the norm at Englewood Hospital and Medical Center, where of 15,000 procedures a year, fully 95% are bloodless.
Englewood Hospital is considered a world leader. For years, its bloodless approach has been used for everything from gastric procedures to cardiac bypass surgery. To date, it's treated more than 50,000 patients. Proponents say going bloodless promotes healing, reduces infection, and saves lives.
It reduces exposure of patients to bank blood, which is associated with negative outcome. The results that we have, which is the lowest morbidity or mortality in cardiac surgery in the state, is associated again with the lowest transfusions rates that have been published so far.
The lowest transfusion rates, not just in New Jersey, but nationally and internationally.
We've had patients come from 42 states in the United States to get care at Englewood Hospital Medical Center, and we've had patients coming from 45 nations outside the United States to get care here too.
Medical literature shows that about 60% of the time, patients receive blood for no good reason.
Transfused blood, according to Ozawa, can lead to serious complications.
Increased risk of death, increased heart attacks, increased strokes. increased ICU stay. And that really doesn't matter if it's your own blood or someone else's. That blood is not the same. Once it comes back out of that fridge, it's not the same as it was when it went in. It does not pick up oxygen very well. It does not drop off oxygen very well.
Well, a new study shows that blood used in transfusions is better if it's less than 2 weeks old. The study showed that heart surgery patients were more likely to suffer problems or even die if they received blood more than 2 weeks old. Right now, the Food and Drug Administration allows blood centers to store blood for up to 6 weeks. And while it's not the final word, this study does provide evidence that blood does deteriorate with age and that the 6-week rule could be putting patients at risk. The FDA is now reviewing the results.
What we're suggesting then is that perhaps 5 million people a year are getting blood with the assumption that it's helping them, and in some, if not many cases, it may even be hurting them. Now the question arises as to why bank blood is different from the blood in our bodies. And one answer appears to be that our blood loses a critical gas called nitric oxide, whose responsibility is to keep those blood vessels open. So in effect, stored blood does not have the ability to open blood vessels. Unlike our blood, which is opening blood vessels, dilating blood vessels, making sure that blood flow is improved to organs in need, such as the heart and brain, blood in blood banks is not able to do this. And consequently, we give blood, but we do not improve blood flow. What happens then is that those red blood cells effectively plug up blood vessels that they would normally be dilating. So instead of helping, they end up hurting. They end up sticking to the blood vessels and blocking blood flow.
But after large studies linked transfusions to a higher risk of heart attacks and death, a growing list of hospitals is changing their procedures to dramatically reduce the use of stored blood. Even the medical community has trouble accepting that blood may carry more risks than previously thought.
We've never taken it to the rigorous tests that every other medical therapeutic has to be put to. And so it's just largely been a belief system, almost a religion, if you will, that if you give a unit of blood, patients will get better.
Lab tests showed that banked blood didn't just fail to open blood vessels, it closed them.
It sucks up the nitric oxide from the tissues and leads to blood vessel constriction. And constriction of blood vessels means decreases in blood flow, absent blood flow, which may be the cause of the heart attack.
Blood that has been stored for over 4 weeks carries an increased risk for infection. Researchers at Cooper University Hospital in New Jersey studied over 400 patients who received a blood transfusion while in intensive care. They found the older the blood a patient received, the higher their risk for infections like pneumonia, upper respiratory infection, and sepsis. For example, patients who received blood 29 days or older had double the risk for infection. Experts say the longer the blood is stored, the more biochemical changes take place, some of which weaken the immune system. Current regulations say blood must be discarded if it has been stored for 42 days.
We have learned San Antonio is about to get its first bloodless hospital.
Now that means it'll be performing surgeries without giving blood transfusion.
But now one local hospital says it can perform even complicated open heart procedures without transfusing any blood. They say it is safe, less expensive, and the patients recover faster.
It's converting the entire hospital into a bloodless facility with the goal of performing 90% of its surgeries without blood. Bloodless hospitals in other parts of the country have been using these techniques for years.
This is nothing experimental. These are procedures being done other places.
Northeast Baptist hopes by going bloodless it will no longer have to delay or cancel surgeries due to a shortage of donated blood. And the move could save the hospital hundreds of thousands of dollars a year. Just 1 unit of donated blood can cost a hospital more than $700. By the time the hospital matches the blood and does the transfusion, the cost to the patient can jump to $1,500 or more.
It's cheaper all the way around. The hospital bill is going to be less. You have a less chance of having a problem with the blood, and you heal faster. You heal better.
Oh, I feel great.
That seems to have been the case with Raymond Talbert. He was able to leave the hospital 4 days after his heart surgery. Northeast Baptist says other patients who received the same procedure with blood transfusions spent 15 to 22 days in the hospital. The average cost of a heart surgery without blood is about $16,000. With blood transfusions, the same surgery costs about $23,000.
But when patients check into the hospital now, they'll be automatically told about the benefits of having the surgery without blood.
Jay also talked with another heart patient who had no religious objection to getting blood or blood transfusions, but that former firefighter said he's more concerned about possible infections or complications from receiving donated blood.
A new study shows potentially life-saving blood transfusions during surgery might actually do more harm than good.
Bloodless surgeries that combine special tools and techniques to speed up the recovery.
Bloodless surgery is one of the fastest growing fields in medicine. By using special techniques, doctors first expand a patient's own blood volume and then use special tools to prevent blood loss.
It's a growing trend definitely across the country.
This transfusion-free surgery leads to fewer complications, less inflammation, better results, and quicker recoveries, even for major surgeries like cardiac bypass.
And definitely showing some better outcomes for the patient.
I mean, this has implications that exceed religion. It started with religions. The Jehovah's Witnesses were pioneers in treating Jehovah's Witnesses in bloodless medicine, but certainly it actually might have implications for everybody out there.
Okay, thanks. Helping a lot of people.
It really is.
Grant Medical Center is helping ease the blood shortage in a different way by literally changing the way its surgeons operate.
Patients recover faster, leave the hospital sooner, and Grant needs less blood from the Red Cross.
So it's been a win-win situation both for the patients and the hospital.
Grant has performed 163 bloodless surgeries since that program began last fall, and tell us that it will consider it for any patient who asks for it.
We should use transfusion as the last resort because there are always complications associated with transfusion. We're going to save lives.
Complication list is very long, and so we only want to use blood transfusion as a last resort.
Bloodless medicine will improve survival rates for wounded soldiers.
When one can reduce complications, reduce infections, reduce durations in the hospital, reduce mortality as a result of surgeries, and save money at the same time, that's a grand slam.
Research began showing that performing surgeries without blood transfusions, known as bloodless surgery, eliminated many complications. Instead, patients just have to have a strong blood count.
They said, why are they doing okay without blood? Saw a year after practicing this way that the witness patients were getting complex surgery and medical care without using blood. Bloodless medicine and surgery can be applied across the board to transplantation, to trauma, to anything else.
As the Institute uses bloodless medicine for more varied surgeries, the hope is that it will soon become the standard method, now with a larger platform to spread the new methods across the globe.